There are just some smells that you're gonna need this, okay? Listen to me. You will need this for some wounds. I promise you. Some of these wounds, you cannot breathe in that mask. Get you some Vapor Rub cream, please. You're welcome.
5, 6, 8. Y'all need to hype me up.
Do that thing with your eyes.
Hi guys, welcome back to my channel. If you haven't already seen part 1 of this video, which is home care in a nutshell, I will have that link down below or maybe in the cards or both. But please watch that video first before you watch this and then come back and watch this video. So let's get into it. So if you guys are here, it's because you want to know what do I have in my home care nurse bag. What do I pack? What do I need? All the other things. So I will say this, everybody likes their own kinds of supplies. For me, there's different kinds of tapes that I like on we're using on people's skins when I do wound care. There's different kind of bandages that I would prefer. There's, you know, there's just this. When you get into this world of home care visiting nurse, there are so many different kinds of supplies. You are going to be actually shocked. Like, I cannot believe how many different kinds of tapes, dressings, solutions, it's just a plethora of stuff. So let's just get into it. You know, I don't want to make this video too long, all right, because this is actually all these videos that I be watching, these could be to the point. All right, baby, let's not waste anybody's time. You see the time? Let's not waste it. So let me grab my nursing bag and let's get into it. So this is the nursing bag that they provided for me. It is huge. It's massive. It has many compartments in it, as you guys can see here. And it has 2 front pockets in the back. Wait, if I cover it, I could probably show you guys here. All right, so this is what the bag looks like, okay? So that's not the actual bag that I use. That bag is big as hell. It's heavy as hell. I know that they have backpacks too. I opted out for the backpack because I felt like by the time I get out of my car and I get into somebody's house, I ain't got time to put the backpack on the back and take it off. It's just too much for me. So I opted for the messenger bag one. But what I use for my bag, because most of the patients are going to have their own supplies. You order the supplies, the case managers orders their supplies. So most of them are going to have their own supplies. So you really shouldn't be bringing in that many stuff. But I do like to bring some essential things. This is my nursing bag that I like to use. Of course, it would be leopard print. Duh, because your girl is wild. Oh, this is my nursing bag that I like to use. It has many different compartments. It's folded up because I'm actually no longer doing the job, but that's gonna be for another day. But these are the many different compartments that I have. It does have like a big spot right here in the front of it where you carry your stuff. It has another part right here, and then it has these 2 zippers right here and right here. So one thing about having a home care bag that you guys really need to understand is you need to have a clean and a dirty side. Figure out which sections can be the clean side and which sections can be your dirty side. Very important. Cross-contamination. You don't bring all the nasty things home, whatever they have in their house. People got MRSA, people got you know, Gram. You don't want any of the stuff to come inside of your house. So just for, you know, clean and sanitary purposes, you want to make sure you have a clean and a dirty side. Next thing. So what I usually keep in my bag. So in the front, my scissors mostly is the only main thing that I have right here. I use my scissors a lot, so I just keep that right here in the front. I also will have like a pair of tweezers right here in this front compartment. And this part right here, which is just a little bit bigger, and I'll link my bag down below if you guys are interested on where I got this. But in the second part right here, I usually have like my thermometer, which I can show you guys. The reason why this bag isn't packed anymore is because I'm actually returning all the supplies. My contract has ended and I'm not going to renew the contract, so I have everything back in the original bag that it came in. So that's why the bag is not filled. But so in that section right here, what I would usually have is my pulse ox right here, a thermometer, you know, infrared one. I have the blood pressure cuff. And I have my Littmann stethoscope right here, which I have to take out because that's mine. That's not going back with them. It's very expensive. So that's usually what I have in that front compartment. I take vitals for every single patient that I see every single day. If I do nothing else, even if I'm doing teaching, I'm going to check your vitals. Another thing too that I actually forgot to mention that I usually carry in the front part where the scissors are is vapor rub, vapor cream, vapor Vaseline, whatever you guys need. Let me tell you something. There are just some smells that you're gonna need this, okay? Listen to me. You will need this for some wounds. I promise you. Some of these wounds, you cannot breathe in that mask. Get you some vapor rub cream, please. You're welcome. I'm gonna take this out because this one is mine, actually. I bought this. That's my little trick. I'm sure it's not like a big secret, but I had an old school nurse tell me that and she saved my life, okay? Because I almost died. I usually do wound care often. So some of the stuff that I like to carry inside of my home care bag is the normal saline, the spray. The spray is so much better than like the irrigation solution that you have to open up the cap. I don't really like that one. This one is easy. You spray it. It's like, you see how that comes out like that? So that's kind of how it is. You shake it up and it will give you like a, it comes out good. You know what I mean? So that's kind of how I like to irrigate the wounds. It's just easier. It's less messier. I always have a pack of gauze, which I go through these so much. I don't like the regular gauze, the ones that have all the holes in it. No, I like the woven ones, okay? So these are the ones that I like to use. As you can see, it doesn't have a lot of holes in it. This is the one that I typically like to use for my patients. Another thing too, I don't use the surgical tape. It hurts. Stop using surgical tape on people. It needs to be just DC'd permanently. I don't know what it's good for besides ripping skin and waxing people. Stop using surgical tape. What I like to use is this tape right here. And the reason why I like it is because I'm gonna show you guys right now. So you kind of pull it apart like this. You see, it's like that. And it's sticky enough to stick. But if you can see, it looks like gauze, right? It literally looks like it's gauze tape. So I actually will prefer this tape over anything. You can put it right on the skin. As you can see, it sticks really good. And when you rip it off, it rips off just like that. So this one, it literally looks like, I call it gauze tape, to be honest with you. It has a real name and it's called, I think it's Mepilex tape, but gauze tape. I really, really do like this stuff and it's pain free. I usually have a lot of abdominal pads, if you guys know what that is. It's just like, it honestly looks like a giant freaking pad, to be honest with you. You just will use that for like any dressings that that you may leave open to air. You might just put like an abdominal dressing on like an incision site. So if somebody had like a knee replacement, I'll put an abdominal dressing on it. It, like I said, it literally looks like a pad, like a super thick square pad, and it comes in different sizes. So I usually have a lot of those in here too, but I think I gave those away to somebody. So this is what it looks like. You see, it's very thick. It opens up like this. Sometimes I'll cut it in half. It has that blue line on it right here. So sometimes I'll cut it down in half and I'll use it twice, or I'll give it to the patient sometimes so that they can use it twice as well. So I always have a lot of these bandage rolls, Curlex wraps, cling wraps, whatever you guys want to call them. It comes in this kind of package here. I'm constantly having to wrap legs up, dressings that, you know, they want to still be able to move around in. So we'll have Tegaderm, and Tegaderm is just like a transparent dressing. So I will always have like a lot of these as well in. So I don't use these as much as I probably should. Sometimes I really do use them, like if on a PICC line dressing, sometimes on people that want to shower, like if they have an incision or if they have like a smaller wound that has a bandage on it and it can't get wet, I'll put a piece of Tegaderm on it so that they'll be able to take a shower, so that the dressing still stays intact and it still stays dry. So that's really what I'll use the Tegaderm for. Thing too that I have are these Mepilex borders. Love, love, love these ones. I have them in all shapes, all sizes. This one is a 6x6. I have 4x4s. I have 3x3s. So I have a lot of those ones as well. Steri strips. Sometimes when people have knee replacements, they need Steri strips. I also use these for when I remove staples, which I do that often too. I remove staples from whatever type of incision that the doctor felt like you needed staples. I will go and remove them when they order it to be taken out. I have a lot of like tubes so that I can draw blood from a PICC line dressing or not from a PICC line dressing. Sometimes I do just have to do venipuncture, which I don't really like to do, but I'll do it anyways. I have a lot of needles in here because I do a lot of INRs. I do INRs often, so this is the INR machine that I use here. It's from Coagucheck. So I use this INR machine, and the sticks are right in here. And then I also have some alcohol pads and just some unused needles here. So kind of just is all together like this. So everything that I need is kind of ready to go inside of here for the patient. I have a lot of skin prep, which skin prep is basically used around the skin. If the skin is having a dressing on for, if there's a part of the skin that's always covered and you're constantly putting like a bandage on it or things like that, you want to put skin prep on it to kind of protect and maintain the skin around the wound, so that one doesn't get, you know, red or irritated or infected. So I have a lot of skin prep. I have a lot of alcohol pads. Obviously I use alcohol pads all the time. I'll use alcohol pads after every vital sign. I will clean off all of my tools. So that's another thing. I have a lot of these vacutainers, obviously, because when I take blood from a PICC line, I need vacutainers to be able to pull from it. And then I have a lot of this Zero-Form gauze dressings. Sometimes you go in to do a wound, they don't have the supplies, or sometimes the dressing that is being used isn't the best. And yes, you need to order to do something else, but sometimes you have to do what you have to do and do what you need to do and ask the doctor for the order after, because child, it be like that sometimes. I have a lot of these cotton tip applicators so that I could be able to put any type of ointments or treatments that I need to use on the patient. I have some of this Hydrofera blue in my bag. I don't really order this often, but I do like to have this there just in case. This is great for packing wounds. And I have a couple of these felt tip pens because when you do a PICC line, you have to sign initial on the PICC line. They have a spot on the Tegaderm that you put on it where you just initial your name and your date so that they know when the PICC line was last done. That's everything that I have in this bag. I have some of these iodine swab sticks. I don't use these very often, to be honest with you. Yeah, that's everything. That's kind of what I keep on a day-to-day basis. And then on the sides, and then like on the sides of the bag, I will have like on this side, I have like a huge hand sanitizer that has a pump. So I'll just leave it right here on the side. It's easy access just to pump the, why am I drawing a blank? The hand sanitizer. It's easy. After every time you take off your gloves, after every use, it's right on the side. You just pump. You don't have to go fishing into your bag for it. And then on this side right here has another pocket. I will just keep my cell phone and my work cell phone in there. So that's basically everything that I would keep inside of my work bag. Again, if you guys have any questions about some of the supplies that I use, what I use them for, please leave them down below. Again, if you missed part 1 of this video, I strongly suggest that you watch that video, and I will see you guys in the next one. Bye.